Hi, I'm Jeff Pickett, Marketing and Training Coordinator for HealthPOINT, your regional extension center for South Dakota, and this is Decision Points, an interactive format to simplify your electronic health record journey. Our goal by providing decision points is to give you an informal breakdown of EHR-related topics so that you can better understand and make informed decisions. It's just another way HealthPOINT helps navigate you towards meaningful use. With me today is HealthPOINT's Education and Outreach Manager, Debbie Hoffman. Thanks for joining me today, Debbie.
Thanks, Jeff. This is a critical topic that many providers have had many questions about in the past few weeks, so I'm looking forward to this discussion. It's important to note that the first set of questions will help providers see if they qualify for the Medicaid EHR incentives, while the remaining steps will demonstrate Medicare incentive qualifiers.
Okay, great. Well, let's get started. This flowchart is the framework for our discussion, so let's break this down for a more simplified approach. The first step of this flowchart has to do with the setting in which providers practice. If you perform 90% of your services in an inpatient setting or emergency room, you will not be eligible for any incentives. If 10% of your services or more were done in an outpatient setting, then we continue to the next step. If at least 30% of your services were furnished to Medicaid patients in an outpatient setting, or if you are a pediatrician performing at least 20% of your services to Medicaid patients, then the next step of qualification involves your provider type. If you're a physician, dentist, certified midwife, physician assistant practicing in a federally qualified health center or a rural health center led by a physician assistant, then you would be eligible for Medicaid incentive dollars provided you implement, adopt, and demonstrate meaningful use of electronic health record technology.
If at least 30% of your services were not furnished to Medicaid patients or the 20% for pediatricians, then we move on to the next step of qualifiers. If you predominantly practice in a federally qualified health center or a rural health center with a 30% needy patient volume and are also identified as a physician, dentist, nurse midwife, nurse practitioner, or PA as described earlier, then you also qualify for eligibility in receiving Medicaid incentives.
The maximum incentive dollars for qualifying on the Medicaid program would be $63,750 over the 6 years for each provider based on the achievement of meaningful use. So Debbie, if you have more than one provider in the practice, how do you determine eligibility?
Good question. If the patient mix for the whole practice includes 30% Medicaid patients, then all the providers would qualify for the Medicaid incentive. However, if the practice doesn't qualify, individual providers could be eligible based on their specific patient mix.
If your practice does not meet the Medicaid requirements, then we come to the next fork in the road. If you bill for Medicare services and are a medical or osteopathic doctor, oral surgeon or dentist, podiatrist, optometrist, or chiropractor, then you are eligible to receive Medicare incentives.
The maximum dollars for qualifying on the Medicare incentive program would be $44,000 over 5 years based on the achievement of meaningful use milestones.
This flowchart is a great way to begin your EHR journey and to understand if incentive dollars are available for your practice. Feel free to view this presentation additional times, and in the future we will address common questions providers have had regarding qualifying for the incentive programs.
If you have any questions that we have not addressed in this presentation or would like more information, please email me at debbie.hoffman@dsu.edu or visit our website at www.healthpoint.dsu.edu.